Hi, I'm State Senator Mark Huizenga, representing Michigan's 30th Senate District. Today I'm outside the Calvin University Science Building with School of Health Dean Dr. Ayoola. She'll be providing us with an overview of Calvin's nursing program, where we'll learn more about the program, the curriculum, and how they prepare the future of public health. This year, I was able to secure a $1 million grant for Calvin's Workforce Development Partnership. This program will allow Calvin University to partner with organizations like Exalta Health, who provide health and wellness services to those in need. Join Dr. Ayoola and me as we learn more about this wonderful program. Thank you for welcoming me to this simulation room. You know, Calvin University's program of School of Nursing is widely renowned as one of the best, I think. And when we see new students coming out of the program into the hospitals in our area here and around the Michigan and frankly around the country, we have a great sense of pride for that. And a lot of that I think goes to you and your new role as Dean of the School of Health, which encompasses nursing and other aspects. Can you talk to us a little bit about what this simulation room does and frankly why we have to have these kind of things?
Yeah. Thank you very much, Senator Huizenga. This room is our simulation room. We actually call this person, and he's a mannequin, but we use the name Mr. Hart. And our students are quite excited to use this because they can check blood pressure, they can check pulses.
When I worked at DeVos Children's Hospital, mannequins were something that a little bit more rigid. This actually looks pretty animated. You see the eyes moving and looks like you got an IV started in here.
Yes.
As you prepare students, it's not just about the acute care facility, but it's about the whole person.
Yeah. Part of the goal in the School of Health is to train our students from holistic perspective. Yes, making sure that you look at the whole person. So this simulation room provides the opportunity for students to learn in a relatively safe environment about things that they might not even see in the clinical setting.
Hello, Senator Huizenga.
It sounds like patient Mr. Hart has a voice and actually can interact with the students. Yes. That's pretty darn cool.
Part of the skills that are important in preparing our next generation of health professionals is what we describe as soft skills, even communication.
Sure.
Taking right history, and with that voice-over mechanism, it's possible for students to actually interact with the mannequin and that person is answering questions. We work also with different software organizations that help us to make sure that they get the best learning opportunity when they're in this room.
I think everybody knows Bachelor's of Science in Nursing. That means you're a nurse, you're working in probably an acute care facility, skilled nursing, or a physician's office. Can you talk a little bit about what it actually means to have a master's in public health?
We have our master's in public health, that's part of our program. We have undergraduate public health program also. And this is focusing on population health. And our students are prepared, they can work in health department, for example, any health agency where they need to promote health or they need to strategize about how do we improve the health of this community.
I think that's one of the most important things that we want to see come from this grant is the fact that we're looking at populations from a very broad perspective.
Yeah.
We always want to make sure that we're leveraging state dollars for the greatest use, and when we see programs like this that make things better for very large populations, that's something I think we can all get really excited about. So thank you so much for the great work you do here, and I appreciate all the partnership and for training the next generation as they take care of me, my parents, and everybody else. Thank you so much.
Thank you.
So Maddie, tell me a little bit about yourself. I know you're here at Calvin, you're a junior, and you're studying a bunch of different things, but also public health. Yeah. Tell me why you want to get into public health and maybe what it means at Calvin to be a student and learning how to take care of broad populations of people.
Yeah, so I've always been really interested in taking care of people. I came in kind of I was looking at nursing, my mom was a nurse, but I didn't love all the sciencey aspects of it, so I felt like public health is a really cool way to incorporate humanities, but also that medical aspect. And so when I saw Calvin had a public health program that could pair well with political science and then potentially maybe work in health policy someday, that just really interested me.
The training you're getting here at Calvin's fundamental and it should equip you very well for no matter what you do.
I took epidemiology classes. I took a class where we went to the Navajo Nation for a spring break and I got to work with clean water. So you just kind of have the statistics side of it, but also working with people. And I think that's like a really important aspect of education here.
Yeah, and I think people think about public health, and maybe you say, well, I'm in the nursing school in public health. They think, oh, you're going to work at a hospital. But I think what you said about helping Navajo Nation, clean water, these are the things that keep people healthy for a longer period of time.
Yeah.
And I think when you can leverage something simple as clean water for a whole population, you can make a pretty big difference for a lot of people. That's great.
Yeah, yeah. So it's awesome to be able to work in like the broader populations and not just be specific to a hospital, which I could work in a hospital someday too. But yeah, you get a lot of options.
Or a health department.
Yes, exactly. Yeah.
Good. So you guys are both nursing students here at Calvin University. Tell me a little bit about what it means to be not just a book learner. I think people think about going to college and yeah, you get these big books, you got your chemistry, your biology, all the stuff you've got to go through. But you guys have some pretty fantastic labs here. I mean, you have this thing set up, looks like a doctor's office. You've got a chair here. Earlier we saw the simulation lab with a mannequin that was pretty animated. There was audio that went with it, the blinking of the eyes and other aspects. Tell me a little bit about this program and what that means to you to have these tools here.
I think something that's really cool about Calvin's program is that we have opportunities to engage in patient care when we're not really in front of real patients, which is super helpful for new students trying to learn how to take care of patients and do all of these skills that would be really intimidating to do on a real life patient right away. It's really helpful to have the opportunity to make mistakes, and it's okay. And yeah, you get to learn more hands-on, but also get direct feedback, have our nursing staff be able to watch everything that we're doing in lab, and then able to correspond that to actual patient care.
Caroline, can you tell me a little bit about this tool here?
Yes, so this is one of the instruments that we use. So the stethoscope is like if you put it on a mannequin. I remember doing this in Peds lab. We had a little infant, and I was using it to like measure the heart rate because it was really, really fast, like when their newborns are born. So I remember using it, and we were like trying to count the rate, and it's just, I'm a hands-on learner, so it's really nice to have this stuff in lab before you go out into a real hospital setting, and you just are a lot more comfortable.
So someday, what's your dream? You want to be a nurse on a floor at an acute care hospital?
I think Calvin's nursing program really does set you up for grad school, like if wanted. A lot of my professors do a really good job of being transparent about what grad school options we have and what they might look like in comparison to nursing school, like undergraduate.
So you've had a chance to work in some community neighborhood clinics. Can you tell me a little bit about your experience?
Yeah, so I did my clinical at Exalta Health in the Burton Heights neighborhood. It was just a really good opportunity because we got to be at the clinic, but then also go out into the surrounding neighborhood to different schools. A lot of the people that come to Exalta are like usually people of minority, so they have a lot of opportunities to get access to healthcare that they might not. So it was just like you were really serving people that need it the most there. So it was just a really cool opportunity. And then our senior year, we actually go back there to do another rotation of community and kind of see the progress that has happened there.
Yeah, that's great. You know, one of the things we're here today to talk about is this grant that we were able to get for the Masters of Public Health. And public health in general, I think, sounds ambiguous to a lot of people, but if you had to describe public health, can you tell me a little about, like, in just 2 sentences, what it means to you?
I'd say just caring for the broader community, not just specific patients. I think we even talk about that a lot in nursing, about how community health is a really big goal for the nation in general. And so I'd say just, focusing on creating broader public health goals rather than just specific patient health goals.
Yeah, and you know, as a state, our grant, making a broader, healthier community, is really important because as a state, we want healthy communities, we want people to thrive, we want to be productive, we want to be active parts of society, and so the work that you do in the near future will be really important. So thanks for what you do, and I look forward to having to take care of me or my family at some point in time in my life.